Welcome to In the Blue. I am your host, Dr. Corey Frogley, and very excited about my guest today because she is covering a topic fresh off the plane from China, where she was over consulting Chinese dentistry, um, and is now back in the States with us. One of the first American consultants to go over there. I mean, that's how popular our guest today, Debbie Castagna, is.
Uh,
And we're so honored and lucky to have you join us today, Debbie.
Thank you, Corey. I really appreciate it. It's nice being back.
I bet. I bet.
Well,
That's a
to the
long
US
flight.
and with you.
Yeah, both, right?
Yeah.
So your topic today, we're excited to bring this to our audience
Yeah.
today because it's a one that I believe largely in. And before we go into the topic, I just want to give our audience a quick background on you. I want to reintroduce you because it's been a few
Okay.
months since you were on our show. And Debbie started consulting back in the early '90s with the Pride Institute and gained her chops there. And now with her expertise, she has been spending time training other consultants and building the most amazing patient-based consulting firm. I mean, her consulting is unique because it's really about the relationships with her and her teams and helping them develop the relationships, the team with the patients. And that's really what we're focusing on today is how to grow your practice with patient advocacy. And this is going to go through like tip to tail from each of the team members of how they do that. So stay tuned. We've got a special offer for you at the bottom. Again, if you want to get access to all of our shows, we're here every Friday. And remember to subscribe to our channel. Click the notification button so you can get notified as soon as we go live. And we buckle in because we've got a show for you today. So Debbie, we're
Yeah.
ready for you.
Let's go. Okay. You just want me to start off?
Yeah, let's jump in to building a practice of patient advocacy. Lay the groundwork of how a practice, dives into this.
Yeah. There has to be a culture of patient first and service, I believe. I mean, that's got to be where it starts. And when you believe that every moment of truth that you're in, whether it's team member to team member to patient, doctor to patient, then advocacy to me is really about being supportive, of the people that you work with and help them to understand what's in front of them and navigating this dental world of ours. And the first time I was really introduced to the concept of being an advocate personally is when my mother was dying 12 years ago, and we knew that it was days before she was going to pass.
Mhm.
And we were assigned a woman who was going to help us to not only navigate what being in the hospital was going to look like, but how to recognize the signs of her passing and how to deal with grief. And I remember, when you are so caught up in the confusion and the grief and the potential for loss, having that help was not only appreciated, but it was so kind and so helpful. And that whole process helped me to look at dentistry and the way that we work with our patients and each other differently. I realize that going through someone's death might seem much more significant and traumatic, but come on, where this is a profession with such humanity
Mhm.
that looking at those interactions and thinking about making the choice to be more humane during those interactions is an important one.
Yeah, because it's very easy to get caught up in the day to day and what
Yeah.
needs to be done and to be ready for the next appointment. And so when you suggest this to a team, where does it start?
You know, It can start with how they talk with someone who's calling with a toothache on the phone. It could start with how one might greet a patient that's brand new to the office who called with an issue, and how that's addressed, that it's looked at something where we actually put ourselves in the patient's shoes versus something where it's another task. It's another toothache walking through the door.
Right? You
So
can
how
kind of get desensitized to it, right?
you do get desensitized, and I think it's very natural for that to happen. But when we can bring more compassion to our work and understand and think about, what should my questions be? What should my body language be saying, and my face and my tone of voice? And those are the introductions to that sort of thinking. It's looking at everyday moments of truth, and how do I bring more advocacy to those moments?
Yeah. No, I love it. So let's go into the role of the doctor.
Yeah,
If he or she is there with that patient and they're finding themselves feeling that, being aware of what you're feeling, whether because you know what's backed up behind you
yeah,
or what you're
yeah,
dealing with right in front of you.
yeah.
What's your training? What you're recommending for them?
So what just popped into my head, because, you mentioned I was with Pride, and when I was at Pride, there was a leadership course that was being given, and there was a cultural anthropologist. She's since passed away, by the name of Angelus Arian, who was speaking with these doctors. And for anybody that wants to look up Angelus Arian, Google her and the Fourfold Way. She's fascinating in what she teaches. But what she said to this group of doctors was, make sure that when you walk into the treatment room, that you too have arrived. That
That's
you, just like what you said,
I like
I've
it.
got all this backed up. I've got a hygienist who needs a periodic exam. Somebody's on hold, all the stuff that happens. How do you pull yourself together and be there and be present? Because, like we were saying, you can get so wrapped up
Mm,
in the task and time, but that's what our patients deserve. Our
mhm.
patients deserve to be the focus and listened to, and feeling that they're warmly welcomed and that you're genuinely interested. And sometimes all it takes to do that is a recognition of that, and say, look, I need to either take a few deep breaths from my belly and center myself, but there needs to be a consciousness with that.
Yeah. No, that's a good point because I know as a doctor myself, we all think my patients love me. We like to think that. But I mean,
And I'm sure they all
for
do, Corey. I'm
well,
sure.
but here's my point: is for years I was seeing over 100 patients a day,
Yeah, wow.
and I had to stop for a second and think about how many of them did I really connect to? Because it's
Yeah,
hard to connect at that
yeah,
level that fast.
yeah.
And I got pretty good at it, but I really had to stop and think. And when social reviews started coming out, and all of a sudden I would get a negative comment, oh my
Mhm.
gosh! I mean, it just was like a dagger in my heart. You mean somebody
Yeah,
doesn't like me? And realizing that a lot of these patients don't know me, they know who I portray myself to be with my doctor hat on. And I really had to take that self look of am I getting pushed through the day from everything that's behind me versus am I, like you just said from that quote, am I arriving to each patient
yes,
present?
yes.
That's a fantastic point.
Yeah, it really was an important visual for me to have, because, when I think about the hundreds of doctors and team members that I've observed at work, how many really, whether it's their face in a chart or face on a computer screen, are appearing calm, making eye contact, asking questions that might be unexpected. If I'm a new patient in the practice, most dentists and most patients' experiences are surrounded around getting clinical with that doctor right away. Do you have a problem? As a matter of fact, there was a new doctor. He wasn't a new doctor, but he was new to purchasing a practice. And he said that it was first-time ownership. And the reason why he brought me in is he said that he wanted to make sure that the attrition was minimal and that, he was getting a return on his investment. So, of course, that's going to be an objective. So he was interrupted during our meeting by the hygienist to do a periodic exam. He said, "Do you mind?" I said, "Of course not." Then I was very interested in hearing how that might go. So he walked in and he was very, very cordial and very polite. And he introduced himself and he said, "It's nice to meet you. What's your problem?" That was the first thing that came out of his mouth. "What's your problem?" And it's like, whoa, that's not going to make me feel particularly warm and fuzzy as a patient. No. And when he came back, because he told me what his objective was, I had to say, I said, well, I asked him if I had his permission to tell him what I said, but I wanted him to hear how different that could sound if he just took the moment to say, "Corey, I was looking at your record prior to meeting you today, and I see that you've been seeing Dr. Wonderful for the last 8 years, and it's such a pleasure meeting you today, and it's my hope that we have at least an 8-year relationship in the future. I'd love to get to know you better." I mean, what a difference, Yeah. And it's something that he didn't even think about. He was going in to do a periodic exam to find out if this lady had problems.
Connect.
Yeah, connect.
Yeah. I love that. So moving on then to the hygiene team, what's your coaching there? How do we help them?
The hygienist is such an important the hygienists are such an important part of the team. Oftentimes, they're the ones that have ongoing relationships with the patients. And, depending upon where the patient is in their life cycle in a practice, maybe seeing that patient more often than the doctor. And, understanding the patient above and beyond, again, the clinical is important. And being an advocate for their health. And I think that sometimes some hygienists sort of get a bum rap for only being interested, lecturing them. Do you floss? Do you brush your teeth? And, there are ways, I think, to communicate those things when you understand what's most important to the patient, what it is that they value, what it is that concern them. And then sort of finesse what it is that you're saying that's based in what's important to them. So if I've got a 60-year-old patient in the chair that says that her mother had pyorrhea when she was young and was missing teeth and had removable dentures, and I just heard this when I was listening to an audio tape of one of my young dentists that I work with. Now we know that this person has a concern about removable. It might be a concern. And when I was coaching this young doctor on this was so funny. I was on my walk and I'm listening to the audio, and something told me this patient was, I could tell, an older guy, and he just could not get over the fact that he was going to have 2 removable partials in his mouth. And something told me, as this guy did not want to be old, seem old. So we were talking about it, and I said, I really think his concern has something to do with age. So I said, how old is he? And he said 63, and he's got a 25-year-old girlfriend. And I said, I knew it. I knew
Bingo.
it. Bingo. So you need, whether I'm the hygienist or the doctor, I need to know if I am working with a patient that has several 6 millimeter pockets and could be looking at the potential for tooth loss. If they have a concern, of aesthetics and looking old because of tooth loss, that's what I'm going to focus on. The fact that to remain, youthful, beautiful, healthy, whatever it is, that's why we're talking about this.
Yeah, I love diving in and like you said, getting the hygienist to identify the patient's motivating factor.
Yes.
And so many of them, like you said, just drill into the patient. You got to floss better. You got to brush more often. Fix these things rather than asking questions. And Debbie, you nailed it on the head. Teaching these guys to ask questions. So let me ask you this: what do you have, like one or two questions? Tell me what those are.
Yeah. So for instance, in that situation, what I might want to ask is, what are your long-term dental expectations? So if somebody said, well, my mom and dad lost their teeth, I figure I'm going to lose them too. Now we know where we're
expecting. Yeah.
How can we serve you in the best possible way? What's important for me to know about you? Rather than getting right into the tell, this is, and it starts with the new patient exam. If the doctor and the dental assistant are asking the questions to, uncover these motivators and concern, document it, then the hygienist has a real leg up so that when she's doing or he's doing their thing, then they're able to say, I understand that keeping your teeth healthy for a lifetime is important to you, and it's why it's important that you and I have this discussion on this. So it's like, whoa, she knows too? How'd she know that?
Yeah, how'd she know that?
We care enough to document it.
And we talk. I mean, that goes back to the morning huddle. And,
yes, you bet.
Yeah, I love that. So let's bring the financial coordinator into this, because we're talking about money now, and as money brings on emotions in people.
Yes.
How do they get through that?
Oh, I love, and when I leave here today, I'm going to work with a financial coordinator that's new to one of my practices. And we're going to be talking just about this, because I see the financial coordinator as a patient advocate. Because when we know that we have a patient with disease in their mouth or a desire to have aesthetics or whatever it is, then it's my job as the financial coordinator to help them find a way. And so often patients are intimidated to go talk to the money person, or that money person thinks that they need to jump right into a financial discussion around what benefits they have. No. What I propose before they even get into the discussion of the fees, let's say that I know that this woman wants a beautiful smile for her daughter's upcoming wedding, and that's why she's there. Before I even discuss the fees, and the clinical team needs to, during a handoff, pre-handoff, needs to make sure that the financial coordinator knows what those motivators and concerns are, so they don't jump right into the treatment plan.
Yeah.
So I've informed the financial coordinator. So I'm going to say, Corey, it's great that we've got this time together. I'm so happy that you've decided to move forward with Dr. Frogley, and I don't know that you could be in better hands. Lisa mentioned that your daughter's getting married in a few months, and that you want your smile to be even prettier than it is right now. And that's certainly something that I'm confident that we're going to be able to do for you. Now, I know that Dr. Frogley has a great way of answering our patients' questions, and I'm wondering if there's anything that I might be able to answer before we get into the financial aspect. So I'm going to do all of those things before I jump into the money.
Build up the provider, acknowledge why they're there.
Yes.
I mean, I don't know if our audience just noticed the pieces that she connected, and so that's why I'm reviewing it, because this is deliberate. Like, the things that she connected are so deliberate, but so powerful. This is what connects that patient to you now and builds the provider, builds the office reputation.
And I care about you. We know why you want this. It's not just because it's logical. You know, that's what people really need to think about. I mean, it's rare that we're buying something only on logic. When I think about some of the shoes that I have, trust me, it wasn't a logical
logic went out the window. We buy with emotion, and then we justify with facts.
Yes. So the emotional part is, in this very simple, example, is that her daughter's getting married and she wants to have a pretty smile for her daughter's wedding. So that's where I've got to tie that treatment plan to what's important to her. And if she also said, this wedding is costing an arm and a leg, and I'm concerned about how I'm going to pay for it, then we also can't shy away from that. So in that same breath, when I say that she's in great hands with this doctor and we know that she wants a beautiful smile, is that, and Lisa also mentioned that managing the finances around your daughter's wedding and the treatment that we're recommending is something that we want to discuss. And I want you to know that we have financial options, and I'm going to thoroughly review those with you. So now it's like she gets it. I don't have to feel embarrassed by saying this. It's out in the open. Yeah.
No, that's brilliant. So, man, Debbie, we could keep going on and on. That kind of thinks we're out of time. These are pretty short paths, and we break these down into these segments so that our teams can use these in team meetings and morning inspirations, things like that. So before we introduce your offer, because it's killer, what would be any final thoughts on this patient advocacy that would be the key thing you want our audience to take away from this?
I'm thinking about a quote that's attributed to the Ritz-Carlton, and they said that how we do business is as important as the business that we do. And if it's at a morning huddle or if it's at a team meeting, to do your darndest to be objective with each other and to say is how we greet a patient, how we show empathy with someone is in pain, how we train a new team member. Are we truly being advocates for that situation, for that person? How are we doing? Is the ego getting in the way? Is time? I don't have time. Come on, be objective with yourself and just think about how can we perhaps bring more humanity to what it is that we're doing.
Yeah, beautiful, beautiful, beautiful. Love it. Well, we've come to the end. I apologize, but you can find Debbie's content on our website. It's castagnacoaching.com. And if you go to castagnacoaching.com/store, we have a special for you right now. And that is you can access 8 ebooks for only $20. They're normally $50, but you can get them for $20 by going to that link. And it's a killer deal because you can take those books and use these in your morning huddle thoughts, in your team meetings for training. And then, of course, you can access Debbie through that website and subscribe and interact. And, of course, Debbie, where are you speaking next? Where can our audience find you?
Speaking next, let's see.
Or what event are you going to be at next?
CDA Anaheim. So
Nice.
I'm trying to think if I just spoke at CDA San Francisco. I think it's Anaheim
Nice.
in the spring, other than being with clients, nonstop.
Yeah. Yeah. No, I know that keeps you busy.
Yeah.
Well, thank you for being on our show today. It's been
My
absolutely
pleasure.
fantastic. Again, building your practices with patient advocacy, and Debbie Castagna is the black belt of that world. And we need to have you back on the show just to hear about your China trip and that
Oh,
interaction and
yeah.
some of
It's wild.
those unique issues. That's going to be exciting. So we'll have Debbie back for that show.
Sounds good.
Thank
Thank you.
you, and have a wonderful weekend.
Yeah, you too. My pleasure.
Remember, In the Blue is with you every Friday. It is noon Eastern, 9 a.m. Pacific, and more great content coming your way. And again, if you haven't seen our newest updates with BlueIQ, check out our insights. It's going to revolutionize your morning huddles. Have a great day.